Hello, everybody. This is Dr. Bob DeMaria. There has been so much talk in the last couple of weeks about the virus. What I want to talk to you about today is being healthy and having a strong immune system. Guess what? There will always be viruses. So let's get really real about what's going on right now. I read all types of information on how you could get the virus. I'm sure that most of you read that also. I want to give you some Dr. Bob tips because that's what people have asked me to do. So this is going to be the official Ask Dr. Bob for everything you want to know about viruses. Number one, stress. If you have stress, it changes the physiology in your body to become acid. I used to get cold sores and fever blisters on my lips. That's a virus. I always have a virus inside of my body because once you have it, you always have it. I work on managing my immune system so I don't have a flare up. When I am in the sun or if I have stress, something happens. My body needs to balance out, and I use calmaxine and L-lysine. This is so important. If you have a history of cold sores, fever blisters, leg cramps at night, even poison ivy, it's a body signal to me that you need calcium. Why is calcium so important? It glues cell membranes together so the viruses can't get in. Do you know why we really are having a problem right now? Part of it is stress, part of it is lack of sunshine, and part of it is sugar. What sugar does to the body, it leaches minerals. It also causes your pH to be altered. So we start having poor health right around the end of October when you have people doing trick or treat, and then we have Thanksgiving, and then Christmas, and then we have New Year's. But then you have Valentine's Day. And then after Valentine's Day, you have St. Patrick's Day, and then we have Easter. So all of these social and faith-based and other type of holiday events place a demand on your body. So during this season, I would encourage you to minimize or eliminate sugar. You may consider 1 L-lysine every day and calmaxine 3 or 4. You do not, I'm going to repeat, you do not want digestive type of calciums like carbonates. They're very, very difficult to assimilate in your body. Now, something else I know is really important is vitamin D. D is in delta. Vitamin D pulls the calcium from your intestine and puts it in your blood. And what happens then is that the vitamin D helps your body absorb all of this calcium. Calcium goes to all the cell membranes and it helps you. So you could add vitamin D. We use a drop or two on our tongue every day. Significant. Now let's just say that you want to take something. People always want to take something. Like, Dr. Bob, what can I take? Well, I want you to know something. I have been taking 10 drops of Agrecept L a day since 1996. Agrecept L is a citric seed extract. Lemon, grapefruit, and tangerine seed. It just does its job on managing those unfriendly bacteria in your body and viruses. We also use a product in our practice called Bioimmunozyme Forte. Let's keep it simple. You could take 2 Bioimmunozyme now through the end of the springtime and maybe May or June and take 10 drops of Agrecept. I encourage our patients to take 10 drops of Agrecept every day. We have another product that we use for kids. It's called IAG. IAG helps your body's immune system, and it tastes good, and it's good for viruses. And if you're really having a major attack, in our practice, we use Rapid Immune. I always make sure I have a bottle of Rapid Immune at home. It's from Gaia Herbs. It just helps support your immune system and all of that functioning optimally. I'm going to throw one other thought out to you right now. If you've listened to me on the internet and my social media at all, I always talk about something called a CBC with a differential. Charlie Bravo Charlie. Wherever you're at in the world right now, I'd encourage you to get a CBC with the differential to get a baseline of what your lymphocytes are like and what your white blood cells are and your neutrophils. I'm going to repeat that. A complete blood count. And it's available through our website if you need to have that. And what goes on is that when you're fighting something, your white blood cell is going to elevate if it's acute, but if it's a chronic condition, your white blood count will be low. But your lymphocytes will increase with a virus. So I want you to be aware of that. So I want you to wash your hands as much as you possibly can. If you have a cough, please stay away from other people, because I've read information about people being exposed because of friends and relatives. So you want to make sure, finally, to drink water. Because of our skill sets and we've been able to look in our office, I know when you drink water, your red blood cells are not touching each other, carrying oxygen, helping your immune system. I know these tips will make a difference. Go to our website for more information. I'm Dr. Bob DeMaria.